Female cancer survivors who receive mammography screening have worse health behaviors compared to those who have never had cancer and are also receiving mammography screening. This is according to a study by researchers at Moffit Cancer Center in Tampa, Florida. For the study, the researchers questioned over 2,700 female cancer survivors over age 35 who were receiving mammography screening. The researchers then compared their answers with the responses of nearly 20,000 women with no previous breast cancer presenting for mammography screening. The researchers compared the two groups according to variables like alcohol use, weight status, physical activity, vitamin use, and smoking behaviors. Female cancer survivors were more likely to use more than 3 vitamins. Individuals who survived cancer were less likely to engage in strenuous exercise compared with those with no cancer history. Compared with women with no history of cancer, cancer survivors rated their overall health as poor at a much greater rate. Women whose age ranged between 30 and 49 and survived cancer had a much higher rate of smoking than those with no cancer history. Females with no history of cancer were more likely to use alcohol monthly or in greater amounts than cancer survivors. However, younger cancer survivors were the most common alcohol users. Study author Sarah Rausch explains, "Studies, including ours, have found that cancer survivors are not as healthy as the general public. As our study demonstrated, unhealthy behaviors such as smoking and alcohol use and a lack of physical exercise among cancer survivors presenting for screening mammography may account for their generally less than healthy status when compared to their peers.